Dear guests, welcome to the Artificial Intelligence program in Health Science. Today we are together with Mr. Roberto Saracco. Roberto, welcome to our program.
Thank you. We have this personal digital twin. We have the digital twins. Now, how can we apply this kind of thing to epidemics? Just think about it. If we have had this digital twin and personal digital twin 3 years ago, would have been able to manage the epidemics differently? Now, this is exactly the kind of question that we ask ourselves in the Digital Reality Initiative at the very beginning of the pandemics. And we presented this study at the International Conference on COVID-19 in London in 2020. Now, the first thing about the epidemics is to discover that there's an epidemic. Okay, so this is the very first thing. So as a single person, how can you discover this kind of thing? Well, you're not a doctor, you don't know this kind of thing. You just can share some of your data. And some of your data that are relevant in case of an epidemic start with where you are, okay? Because if you are in a certain location and several other people are starting to complain about something, then, and you get that something, then there might be an epidemic. So the first step is sharing where you are, understanding your content. And this can be done through GPS, Wi-Fi, and shaking with nearby devices like Bluetooth and so on. Then the other thing is to check about you, okay? How do you feel, okay? Are you feeling fine or, you know? Well, now we have several ways of getting suspicious about your health, which is not just about testing, okay? Of course, if you feel something bad, then you go and test yourself and you know for sure whether you got infected or not. But what we would like to do in an epidemics is actually to detect this before you realize that something is wrong with you. Because once you've got it, you got it. And probably you have already started to infect other people. So there have been some studies like those carried out at the Carnegie Mellon University and at the Cornell University, where they have discovered that the people infected by COVID start to talk a little bit differently, okay? Now, this is interesting because this little bit differently is something that you don't detect. You are not aware of that. But whenever you're talking to your cell phone, and you talk to your wife, you talk to your girlfriend or whoever, okay? Well, the cell phone can develop what is called a digital signature of your voice. And it memorizes this digital signature. And next time you're talking, is confirming the digital signature. And it can also discover that it's slightly different from the previous one. And there's some slight differences that can pinpoint the probability, not the certainty, but the probability that you actually have contracted an infection. It might be COVID, it might be something different, okay? So at that point, it can raise a flag. This flag is local, okay? So it's not sure at all that you have something. But if this flag is raised up and your phone checks around and say, oh, I've been around people that have raised the same flag, and some of these turned out to be positive, then the probability is much stronger, right? So it's going to tell me, watch out, okay? You might have nothing at all, but better be careful than sorry, okay? And you can also do this kind of thing by having some additional stuff. Like you see here is an oximeter that you can measure the oxygen in your blood. You can use a temperature measurement and all this kind of thing that can provide further data that can help you understand. And of course, the cell phone, because in the end, we are always using this kind of thing, okay? So the cell phone is actually the container for your personal digital twin. And your cell phone can analyze all this data and find out if all the different things that it is receiving turns out to raise this red flag or not. And it can also go and check around and see how is the situation around here. Are there other people that are showing the same thing, okay? And some of these people have tested and they proved that they were actually positive. So this is actually a way of providing more and more awareness to ourselves. Now, we decided to apply this kind of concept, and it was tested a little bit in some areas by saying, okay, let's imagine that we have a personal digital twin. Now, with this personal digital twin, you see the triangle here. I draw this diagram. I'm very bad at drawing, but you get the feeling, okay? We've got this triangle is personal digital twin. And these personal digital twin are interacting with the physical twin, with me, with you, with your friend, okay? So these are all separated. And we have seen before that this personal digital twin in your smartphone can perform some local analytics, okay? So it can work out something. And if it gets a suspicion, then it can raise a red flag. Now, this red flag goes to the healthcare institution. And the healthcare institution may be receiving several red flags from many people around the country. But they become interesting when they are near one another, okay? So in the same area of the city, you get this kind of thing. You get this kind of thing from people that took the same plane, okay? So that can raise the awareness of this kind of thing. And the healthcare institution can send out warnings, say, hey, you better be checked, okay? Because you never know, okay? There's a potential for this kind of thing. But also the healthcare institution is connected to the authority. And it's the authority that has to take a decision on what should be done and what shouldn't be done at the societal level, okay? Are you supposed to stay at home? This is not a decision for the healthcare institution. It's a decision of the authority because it's going to limit your freedom. So it's the government that is going to decide this kind of thing. Now, what we try to engineer is a mechanism so that your privacy is maintained and you are decoupled from the knowledge of the system. So suppose I've got COVID, okay? And by dialoguing, but I got the first suspicion from my cell phone. The cell phone communicated with the healthcare. I got to testing and I discovered, yes, I have COVID. And I know that the authority said that when you have COVID, you got to stay home, okay?
Yeah.
The authority doesn't say anything, doesn't know anything. Authority doesn't know that I have COVID, okay? You don't know it. The healthcare authority knows that some people in this area have COVID because they need to know that some people have, because to monitor the epidemic, okay? So I know I have to stay home, I stay home, fine. What if I'm not staying home?
Yeah.
Well, if I'm not staying home, then my cell phone, my digital twin, will raise a flag to the healthcare institution. There's this guy that was supposed to stay home is not staying home, okay? Yeah. And this information at that point is revealed to the authority that can step in. Now, is this an invasion of privacy? Yes, absolutely. But this is the same kind of invasion that they do when you're speeding up and they take your plate, okay? And they say, oh, this guy is speeding up. If you're just driving and you're not speeding up, there's a camera looking at you, but nobody's knowing that you're going that way. But if you're speeding up, then they step in and you get a ticket. So it's exactly the same situation. As long as you're working with the rules, with the framework that has been decided, that's okay, okay? Your privacy is kept. But if you're stepping over, then you're creating a problem, a danger for the society. And the society has to protect themselves, okay?
Not
to what extent?
Yes.
Yeah. To what extent? Well, that's a state decision, okay? And different countries will have different interpretation of this kind of thing, okay? There might be some countries that are much more strict and some that is more loose, but that's a different kind of decision. Well, so the crucial point here is to use the personal digital twin to provide awareness on your side, to share potential risk to the society, and to balance between the privacy and the sharing. And this balance has to take care the value perception, okay? So what are people in that particular area perceiving, okay? Is it important? I remember I spent some time in Japan, and when they had a cold, a simple cold, they were wearing a mask because it was felt that it was very rude, unpolite, move around with a cold because you were infecting others. whilst I've seen that in Italy, people moved around with a cold without any mask. So different cultures are reacting differently to a certain specific situation. And then, of course, there's a regulatory enforcement, okay? The situation, what is your government decide to do? Now, all this kind of thing can be managed if you have a decoupling, because what is the set of data that you own, because you generate your data. I've got a fever, I've got a cough, okay? These are my data, with the one that are shared. But the one that are shared are not necessarily the one that I have the fever. Actually, the only data that should be shared with the healthcare institution is the fact that there's a probability that I have some problem. I can be infectious, okay?
Yeah.
So is this probability, these are metadata. And it's important to divide the two, okay, between, because you don't want to have this kind. Now, there's another thing. It's not just about sharing my data. It's also about becoming aware of what's going on. Because if I'm aware of what is going on, then I can behave myself differently. So if I receive a message saying, look, in your area, there's a higher probability of getting infected, then probably I will be wearing a mask every time I'm going out, okay? So becoming aware is also very important. And becoming aware of the danger that I pose to other people is also very important. Because by and large, most of us are good fellows. Sometimes we are behaving in a not appropriate way just because we are not aware of what the problem we're generating. But if we were aware that our behavior can badly affect others, we would behave differently. So becoming aware is very important. And artificial intelligence perform a data analytics that are clustered and harvested from all the area and from the country and from other countries can really provide me awareness that can be turned by my personal digital twin into guidelines for behavior. So my personal digital twin is going to tell me, okay, you're going out, be careful, okay? Wear this kind of mask, okay? Or if you just want to go out, don't go in that particular area at this particular time, okay? Because maybe more dangerous.
Yes.
Okay? So this is the kind of thing that are being done. Now, another thing that is, I feel important is to understand that when you have an epidemic, it's not everywhere, okay? There's an area that is more, another area that is less, okay? There's a building that have several families affected, another building that they don't have. So if I can share this kind of data at community level, in my office, in my building, my apartment building, and so on, then I can provide islands that can be isolated. So you don't need to isolate everything, okay? But just the island where this is effective, it's important.
It's very important.
Yeah, so this is the kind of thing. And you can decide that your personal digital twin can dialogue with other personal digital twin of your family or your friend at the office and so on. So you decide what the kind of. Now, the final point about the epidemics is that whatever action you're taking is going to impact the economics. And this is a major issue. So the government has to decide what kind of precaution to take, knowing that if they lock down everybody, the economy will go down. And when they open up, the economy will go up. It's a V shape, okay? But if they do that too soon, then probably they will get another infection. So you got this W shape, okay? Or you may say, okay, no, I better take it for a long, long time, lockdown, so that when I go up, there's no more epidemic. But that is costing you a lot of money. That's the U side of the economy. Or you can even impose such restriction that your economy is going to bottom up. You don't want this kind of thing. Now, using digital twin, connected to personal digital twin, you can really get a feeling from a government point of view of what the situation is and take measures that are in sync with the kind of thing that you should actually do, okay?
Dear guests, welcome to the Artificial Intelligence program in Health Science. Today we are together with Mr. Roberto Saracco. Roberto, welcome to our program.
Thank you.